Among the most common injuries that the shoulder can sustain is the torn rotator cuff. These injuries can be either acute, the result of a trauma or accident, or repetitive, as in the case of an athlete who throws a ball using the same motion over and over. Sometimes the damage to the shoulder can be moderate enough that rest, exercise, and medicine will suffice to treat it. In cases where the damage is more severe, however, surgery is called for. Lakecore Medical Center is a high-end, full-service clinic that features an extensive orthopedic surgery service. We have all the facilities and expertise to repair the rotator cuff using either arthroscopy, the insertion of a tiny camera and micro-instruments through several small incisions, or traditional open surgery. In a moment, I'll go into more detail about how the procedure works at Lakecore. The rotator cuff is a group of 4 tendons that stabilize the shoulder and allow its full range of movement. When any of these tendons tear, it is referred to as a torn rotator cuff. If the tear is slight, it may be possible to treat it non-surgically. Ice and physical therapy, anti-inflammatory medications, and cortisone injections can help. When the tear is more significant, however, the torn tendon or tendons will not heal on their own and need to be reattached surgically. If you've been told that you need rotator cuff surgery, Lakecore Medical Center's exceptionally well-trained and experienced surgical team will be able to assure you of the best chances for full recovery. The most common and least invasive form of surgery on the rotator cuff is arthroscopic. The doctor will make small incisions to be able to introduce the arthroscopic camera for excellent visualization of the site before suturing the torn tendon. Recovery periods for arthroscopic surgery are relatively short, with minimal pain and discomfort. When the tear in the shoulder's tendon or tendons is too great to be repaired arthroscopically, traditional open surgery is sometimes still called for. A large incision is made on the outside of the shoulder so that the surgeon can have full access to the damaged tissue. Sometimes, a rotator cuff tear is caused by bone spurs that rub against the tendons and cause damage. If this is the case, a procedure called acromioplasty may be necessary to remove the bone spurs and avoid the risk of future damage to the tendons. In either case, rotator cuff surgery at Lakecore is done on an outpatient basis. After the operation, you will be able to rest in one of our comfortable and well-appointed private rooms before being released to recover at home later that day. You may need to use ice to reduce swelling in the days after the procedure, and pain medication may be called for to manage discomfort. You will also have to wear a sling for a period to keep the shoulder in the right position to heal properly. During the first 6 weeks or so post-surgery, active and excessive movement of the shoulder is not permitted, though very gentle physical therapy may begin before that. Should you require it, Lakecore has an advanced physiotherapy program on the premises that include aquatic therapy, the latest trend in gentle reconditioning for injury. While we usually see excellent outcomes from this surgery, the shoulder is slow to heal, and many patients may not feel completely themselves for 6 to 9 months. If you need rotator cuff surgery, the experience of the surgeon and the use of the most advanced and up-to-date techniques are certainly important considerations. At Lakecore Medical Center, you'll have access to some of the leaders in the field of orthopedic surgery. There's no need to languish on a list. Call Lakecore for a consultation appointment today.